welcome to Korman Plastic Surgery. I'm Dr. Josh Korman, board certified plastic surgeon, and I'd like to welcome you all to our virtual event where we'll be covering facial rejuvenation, specifically max lift and deep plane facelift. I encourage all of you to stay till the end of the event because not only do you get exceptional promotional pricing, but also if you put any questions you have in our questions tab, then they will be answered at the end by a live team member. We have exceptional promotional pricing for anyone that signs up for the procedure and has it before the end of the year. And also, one lucky winner will get an amazing package of Botox and fillers. So thank you for being with us and join us. So the word facelift is such a confusing name and term. Everybody doesn't really want to talk about a facelift, but they talk about little work or little something. But basically, we don't age like an escalator. We age like an elevator. We kind of fall like that. So what does rhinopectomy, facelift, what does it mean? It basically means doing stuff surgically to the face and neck to rejuvenate, to create a more youthful appearance. So the terms are a little confusing with facelifts, and what's very in vogue you hear about is the deep plane. And that's, what does that really mean as opposed to a SMAS facelift? These are all a little bit confusing if you're not in the biz or didn't go to medical school or plastic surgery school. So what this involves is that if you think of chicken, when you have a piece of chicken, there is the gristle over the chicken, the part that you take off so you can eat and it tastes good. That gristle is the tough layer over the muscle. That's the strength layer. That is what gets pulled on during a facial rejuvenation procedure. What happens in a deep plane is that you have what's called the fixed and the mobile SMAS. SMAS is that gristle. So if we're using me as an example, there's the fixed SMAS, which is close to the front of the ear, that moves but doesn't move that much. And then there's the mobile SMAS. That's this area down here that everybody wants lifted, not pulled, not weird to the mouth, but it's this area that people want to be lifted because that's what comes down as we age. And what a deep plane does is it goes after the mobile SMAS to move up and also in the neck to create long-lasting, natural, wonderful results. Max lift sounds like max, like big, but it's not. It's MACS, which stands for minimal access, meaning short incision, cranial suspension, pulling up. And what it's really designed for is for jowls. It does a little bit for the neck, but it's mostly for jowls. And so what it does is it's just a small incision in front of the ear and under the skin a little bit, putting some stitches in the SMAS, the gristle on top of the muscle, and then pulling up on the jowls. So it's a very quick recovery, very natural result. You can do it under local anesthesia, and it is very, very enjoyed. It's very appreciated. People love it because it's simple, easy, natural, quick recovery, and great results. So lots of people trying to figure out what is the right procedure and what is the difference in this case between a max lift and a deep plane facelift. What is the right thing to do? And without getting too complicated, basically it has to do with the neck. If you have because obviously everybody wants the simplest, least expensive, longest lasting, best result procedure. So the main difference between a deep plane facelift, which is face and neck, and a max lift is primarily how much is the neck an issue and how much is the jowls an issue. So to give you an example, on me, a max lift would do something like this, and the deep plane neck would do this and that. It's really to help the neck in addition to the front and doing the jowls. So the difference is, and what you do, it's really about the neck. So how long is the recovery from these procedures? Well, a max lift, if you have hair that you can cover the little bit of bruising, which if it happens, in front of the ears, then you can actually go back to work really the next day. The stitches come out in a week, but they're just covered by your hair because they're just in front of the ears. The recovery for the deep plane facelift, that's probably more like 10 days. Really, it depends whether you mind people know we did anything, if there's any bruising or not, but we give you good anti-bruising products like bromelain and arnica, which helps a lot. And so the recovery generally for max lift is really just a few days, and for a deep plane facelift, you can think of it as a couple weeks. Both of them are really easy to recover from, generally low pain and exceptionally happy results. So just like on airlines, you have so many choices, like why come to Korman Plastic Surgery? So the first thing I would tell you is that I've been doing this for more than 20 years. Two is nobody cares more about your result than you, except for me. And it is the most important. I spend a lot of time with my patients trying to make sure we're both on the same page, understand what you're trying to achieve, and I always try to under-promise and over-deliver. I have a many-decade experience teaching at Stanford University. That's also where I trained. And I have found great satisfaction in helping patients, now at this point, probably thousands of them, achieve their goals and risk their dreams. And life happens, and nobody wants you to be more happy than me. So we're talking about your face and how to get facial rejuvenation. So you would actually be a really good candidate for what we call a max lift, which is that small incision. So the incision is really small. It's in the hair here and really on the edge of the ear, in this little part of the ear. So you can actually wear your hair up and you won't even see a scar. And what it really does, if you look in the mirror, so it really pulls on the jowl. That's the part, it's lucky for you, your neck is very youthful. So we're talking for a max lift, you would be a really good candidate because this pulls up like this. It doesn't pull tight on the mouth. It's really the part that tends to age because we age like an elevator, and it pulls up like this. It also has a tendency to pull here, so the mid-face even helps with the nasolabial fold somewhat, and it creates a really nice sharp jawline that puts you back where you were several years before. So, you're very pretty, so we just try to enhance your beauty.
Hello everyone, and thank you so much for attending Dr. Korman's Max Lift and Deep Plane Facelift webinar. We were so happy that you could attend. So please check your text messages at the end of the event to be notified if you'd like to book a consultation. Our surgical PCC, Nicole Black, will reach out to you to get you scheduled. And lastly, there is about 15 to 20 minutes that will be on after the webinar is over. You can drop all of your questions in the chat box below and you will be answered promptly.